Hello, everyone. I'm Phyllis Dickerson, the CEO of the African American Mayors Association. Thank you for joining us today for our Mayors Breaking It Down podcast. Joined with my co-host, of course, Mayor Van Johnson from the great city of Savannah, Georgia.
I just love when you say that, but thank you so much. Great opportunity to be with the African American Mayors Association and our affiliates and friends.
So today we have joining us Dr. Clyde Watkins from VillageMD, MD. So we affectionately call it VillageMD. And they are on our business council. So thank you so much, Dr. Watkins, for joining us today. For those people who don't know what VillageMD is, can you tell us what is it?
Well, thank you. It's really great to be here. And thank you for the invitation to give me the opportunity to talk a little bit about value-based care. VillageMD and really Village Medical, which is the unit that I work for, is a value-based care organization. It is a primary care-based, value-based care organization that really is focused and dedicated on achieving three aims to make healthcare more accessible, more affordable, and more accountable.
So when we talk about in terms of traditional care, and now you have this value-based care concepts, what are the key differences? Because traditional healthcare would say that, it would have the same attributes as well, correct?
Yeah, absolutely. So let's kind of take a step back and kind of look at, traditional healthcare. And really, value-based care is really different from traditional healthcare from top to bottom. So if you look at the historical evolution of the American healthcare system, it was largely built around emergency care situations. Mm-hmm. So if you look at it from 100 years ago, it makes sense because you're dealing with acute illnesses, accidents, wounds, health issues that can be treated immediately. If you just look within my lifetime, I'm not going to ask anyone their age, but within my lifetime, the Medicare system was, again, developed around catastrophic health situations. So again, Medicare A, which is how it started, covered hospitalizations. It wasn't until later that outpatient visits were covered via Medicare. So our healthcare system has been largely built around catastrophic care and emergency situations and acute illnesses. Well, today, that's not what most people face. Most people face chronic illnesses. They have, we're treating lung disease and diabetes and heart disease. These are diseases that people live with, and they require a different type of care because it's ongoing chronic care, longitudinal care.
So why is primary care essential to value-based care?
Couple of things. Let's go back to talk about why it's called value-based care. It's called value-based care because we place an emphasis on high-value services for patients. So that really allows us to take a broad look at patients' health issues and really identify disease before it really becomes more serious and treat it before it becomes more serious. So again, why is it central to the role of it? Is primary care is critical to the value-based care formula because you need someone to see the whole picture, determine a person's whole needs. Generally in primary care, I say that primary care in the 21st century, it's a team sport. When I started practicing medicine 35 years ago, give me my medical assistant and a patient, and I will treat them all day and I will take care of them. But now disease and primary care is much more complex. Our knowledge of disease processes, our knowledge of treatment is astronomically greater. Patients that I would hospitalize 30 years ago, I treat them as outpatients now. I will give them an antibiotic or a med, send them home, maybe bring them back in a couple of days, make sure that they're okay. So primary care is a critical part to value-based care. I think, many of us are football fans, and I like to use the analogy that primary care physicians like a quarterback. We're going to read the defense, see what's out there, see if we need to make adjustments. And that's what a primary care physician will do. So I'm going to talk to you first of all. I'm going to find out your history, find out about your family history, look at your habits, do a good exam, talk a little bit about mental health, talk about nutrition, and start to make some adjustments and some decisions based on what your care should be and what is the best possible care for you. And then we're going to go ahead and create a plan and implement that plan. The thing about how our healthcare system is organized today and why it's a team-based sport and why a team is needed is because in traditional care, the only thing that's paid for is the time that you spend in the office. So when you hit the door and register and when you leave, that time is paid for. If you have other needs outside of that time that we're in face to face, then the traditional healthcare system does not address those. So if you have social needs, social services needs, if you have the need of a nutritionist or a therapist, then those types of services aren't paid for. And that's part of the value that value-based care brings, is that we're able to surround your primary care physician with a healthcare team. So we like to say that our goal is to make healthcare more accessible, affordable, and also more accountable.
Well, Doc, at one time I remember my grandmother had one doctor for everything, one doctor.
Yep.
Now I have a team of doctors, just like the president of the United States has a team of doctors. And we know that traditional healthcare has become increasingly more expensive, difficult to obtain. And really, some people don't have the opportunity to be able to acquire it. I wanted to know about your thoughts about value-based care as it relates to supporting health equity.
Okay. Well, there are three main ways value-based care can support health equity. And we talked about those three aims of accessibility, affordability, and accountability. That is really the core of value-based care. So first, expanding access, especially in underserved communities. That means making sure that every person can see a doctor and build a long-term relationship. And that's the key, building a long-term relationship. My best relationships, my best patients are those I've had a 20-year experience with. Also encouraging regular engagement with your healthcare provider. So one of my challenges with patients that are new to me, they oftentimes ask me, well, why do I have to come back and see you? I often ask them, do you get your oil changed every 3,000 miles? And their answer is yes. Why won't you do that? Because my car will stop on me. Well, why do you treat your car better than you do yourself? So come back, let's monitor your health condition, let's stay ahead of the game and keep you healthy. So really, access is really key. As a matter of fact, Village Medical did a study in Houston and Harris County, which includes Houston and Texas, that showed we were able to increase primary care visits across all demographics. So really maintaining access and improving access, and also managing healthcare, managing disease better. So we were able to improve access and increase the number of primary care visits by 101% in Hispanic patients, 71% in Black patients, and 51% in white patients. But what that meant was that we lowered hospitalizations for patients with chronic diseases, keeping people out of the hospital, decreasing the cost of care, and keeping people healthy. The second way it improves health equity is by improving health outcomes. If you see a primary care physician, you're actively engaged with your primary care physician, you get better health outcomes. And third, it supports health equity by just delivering care more efficiently.
So how do we get this new healthcare model in our communities?
Well, the President Biden, the Biden-Harris administration, they've made an explicit goal of aligning, creating value-based care initiatives. One is ACO Reach, and the Reach part of ACO Reach means realizing equity and access and community health. So again, on the national level, it is a priority, including equity goals within the ACO and within value-based care. They've also created bipartisan legislation in Congress called the Value in Healthcare Act. So it's going to push incentives for there to be greater participation in value-based care roles. Also, lastly, it is a priority of CMS. So CMS has a goal of getting all of its beneficiaries in a value-based care arrangements within an ACO or in an organization like Village Medical by 2030, and we're about 50% there. So within the next 6 years, we have to enroll 50% more of the Medicare beneficiaries in order to achieve that goal. So a lot of the policy prescriptions that's going on within Washington is really going to support that effort. And they're also testing other models of value-based care through the Innovation Center within CMS.
What additional policy changes do you see, and what does the role of impending elections play on all of this?
The great thing is the Value in Healthcare Act is bipartisan. So legislators on both sides of the aisle recognize the importance of primary care. One of the big differences between our healthcare system and healthcare systems in other rich countries is that their healthcare systems are built around primary care, and they have better outcomes than America. America has the most expensive healthcare system. It doesn't have the best. And until we start to align incentives around promoting primary care, we're going to have a challenge. And that's the real challenge and the key going forward.
So why are partnerships like AAMA important to this work?
You cannot get anything meaningfully done without important partners. So having great partners is important. Changing healthcare is like trying to stop one of those big cargo boats, cargo ships in the Savannah River, asking them to stop and turn around. That's not something that's easily done. So again, having partnerships like AAMA, having mayors that understand their communities and are willing to partner with healthcare organizations to help them address social determinants of health, and also point us in the direction where there's need within the community. We can't do this just within healthcare providers. We need to have partnerships not only within the healthcare sector, but also within governments as well.
So thank you, Dr. Watkins, for joining us today for our Mayor's Breaking It Down. We have truly enjoyed this conversation and being a subject matter expert. Wow, I learned something today.
Well, thank you so much. I really appreciate it. I've had the opportunity to speak at an AAMA convention. Absolutely thoroughly loved it. I think that all of the mayors are doing God's work. And I appreciate the way that you all affect your communities, set a wonderful example for our youth. And I really look forward to partnering with you, with Village Medical, and partnering with AAMA in the future. Really appreciate the effort.
Doctor, thank you for serving on our business council. We recognize that mayors, they think mayors are supposed to know everything. We don't. Many of us are not in medical space, but things like social determinants for health and healthcare affect everything we do. We can't pass policy if we don't have people that are healthy. And so thank you for being on board and serving with us. We appreciate it.
Thank you so very much. I appreciate it.
Thank you. We look forward to having you again.
Yes, ma'am.